Before we start, this video talks about spinal cord injury and wheelchair use. A spinal cord injury happens when the spinal cord is damaged, and it can cause weakness or paralysis below the injury, sometimes leading to wheelchair use. We'll also talk about how spinal cord injury is different from cerebral palsy. If you want to learn what it is, how it affects daily life, and how to support people who live with it, keep watching. Part 1. What a spinal cord injury is. A spinal cord injury happens when the spinal cord, which carries messages between the brain and the body, is damaged. When the spinal cord is injured, it can affect movement, feeling, and other body functions below the level of the injury. This can cause weakness or paralysis, like paraplegia, which affects the legs, or tetraplegia, which affects the arms and legs. Some people with spinal cord injuries use wheelchairs or other mobility devices to move around and stay independent. Part 2. How it feels main effects. A spinal cord injury can change a lot of things in a person's life. Depending on where the injury is and how serious it is, a person may lose some or all movement and feeling in parts of their body below the injury. They may need help with walking, getting dressed, bathing, using the bathroom, or moving from a bed to a chair. Many people learn new ways to do daily tasks, like transferring to a wheelchair, using special equipment, or changing how they move. Along with physical changes, people can also go through emotional changes, like feeling sad, frustrated, or worried while they adjust to their new body and routines. Part 3. How it's different from cerebral palsy. Spinal cord injury and cerebral palsy can look a bit alike from the outside because both can affect movement and muscle control. But they are not the same condition. Cerebral palsy usually happens very early in life because of brain damage or brain development problems before, during, or shortly after birth. It is a lifelong condition that does not keep getting worse over time. A spinal cord injury usually happens later, after a person has already developed, often from things like car crashes, falls, sports injuries, or violence. In simple terms, cerebral palsy starts in the brain early in life, and spinal cord injury is damage to the spinal cord later in life. Both affect movement, but they start in different places and at different times. If you're finding this video helpful so far, please share, comment, and subscribe. Part 4. Everyday life and wheelchair use. People with spinal cord injuries can live full lives, but they may do some things differently. Many use wheelchairs, power chairs, or other mobility aids to get around at home, school, work, and in the community. Wheelchairs are not a symbol of giving up. They are tools that give people freedom and independence. Daily life might include extra planning, like making sure places are accessible, checking for ramps or elevators, and managing things like skin care, pressure relief, and bathroom routines. From the outside, people sometimes only see the wheelchair and forget there's a full person with feelings, goals, and a life beyond the injury. Part 5. What can help? Support for people with spinal cord injuries can include rehab, physical and occupational therapy, assistive technology, and accessible environments. Rehab can help people learn how to use mobility devices, strengthen the muscles they can control, and adapt to new ways of doing daily tasks. Accessible housing, ramps, elevators, accessible transportation, and adaptive equipment also make a big difference in how independent someone can be. Emotional support, peer support groups, and counseling can also help people and families adjust after an injury. Part 6. How to support someone. If you know someone with a spinal cord injury, there are simple ways you can be supportive. Talk to them like you would talk to anyone else. Do not talk down to them or assume they cannot understand just because they use a wheelchair. If you have a spinal cord injury, I want you to know that your life still has value and meaning. You are not just your injury or your wheelchair. It is okay to need help and to use tools like wheelchairs, lifts, or other devices. These are not signs of weakness. They are supports that help you live your life. And if you know someone living with a spinal cord injury, please be kind, patient, and willing to learn. A little understanding and respect goes a long way. Thank you for watching. If this video helped you understand spinal cord injuries and wheelchair use a little better, please share, comment, and subscribe.
One leg to stand, but but he runs through the fire. Brandon's got grit, his heart won't tire.